Hello friends. Topic for the today's class is essential newborn care. So this topic is also very much essential or like important for all the exam point of view and for the practical point of view. Also, this topic is very much important. So now we will discuss essential newborn care. So what the basic care we can give it to the babies. Uh, Immediately after the birth, so it depends on the severity of the baby, if the baby is normal and if the baby is high risk, or if the baby's Apgar score. So there are so many deciding factors. So what care, so today we are discussing the routine care we are giving to the newborn baby. Essential so the first is definition. Essential newborn care is a comprehensive strategy to reduce the death of newborn through cost effective interventions before conception, during pregnancy, immediately after birth, and postnatal period. So by giving appropriate care to the baby, we can reduce the morbidity and mortality of the baby, and cost effective also. So what are the purpose of this essential newborn care? So first is to make sure baby is thriving. Then next is early detection of problems or danger signs. Then next is helping the mother to meet the baby's basic need: warmth, feeding, infection prevention. So most of the mothers who are the first time mothers, they don't know anything about how to take care of the babies. So if we are teaching properly, we can prevent many complications, identify the danger signs, or identify the earlier problems, so we can reduce the complications. The next is baby breastfeeding within 1 hour of delivery. So it depends on the mother is normal delivery, in that case immediately we can start the breastfeeding, or within half hour we can start, or those who are cesarean section mothers, we can start within 3 to 4 hours. Then next is advising and encouraging mothers road breastfeeding exclusively. So this needs like we need to counsel, we need to demonstrate to the mother that how to give the breastfeeding and right way, because initially, or those who are the first time mothers, they face many problems for during the breastfeeding, like engorgement, uh, too much pain, cracked nipples. So these are the most common problems. Then next is advising mother and family members about danger signs and baby care, so which is very much essential. Then next is treatment of key problems such as asphyxia and sepsis, so that also we can give. Making plans for continuing care, immunization, and growth monitoring. Then next is components of this essential newborn care. First one is prepare for the birth, baby's birth. Then second is immediate newborn care. Then the newborn care during the first day. Then newborn history and physical examination, and care of newborn during the first 28 days. Because the majority of the complication arises within these first 24 days. Teaching and counseling mother and family about the newborn care, because the baby is adapting from the womb environment to the, which is very much like pampering or temperature, everything he is getting. So he is adjusting the outside world. So that first 24 days is very crucial for the babies. So appropriate attention and the care is required during that time. So first one is prepare for baby's birth. So prevention of infection is our first motto. Then second is WHO, 32% newborn death is due to the infection. So prevention of infection is our first goal. Then second is what we can do for this is wash our hands at the time of delivery, while handling the baby. Everywhere we need to take precautions for the prevention of infection. Then next is personal contact infection. So those who are having any infectious diseases, in that case we need to uh, keep away from the baby. Those who are having the common cold, viral fever, any infectious disease, that persons we should keep away from the newborn as well as mother. Use the 3 infection prevention step before the baby is born: equipment, supplies, and linen and surface. So all these born equipments is like scissor we are using for the cutting the cord, supplies, gloves, and everything, linen and surface, in that the baby we are handling and we are receiving the baby. So all we should keep in mind to prevent the infection. The next is decontamination. Time to time decontamination of like using sterile supplies, waste disposal, and there are so many components of the decontamination. We prevent the cross infection among the babies, so that is also the one of important aspect for the preventing the infection. The next is cleaning. So cleaning is must, like time to time cleaning of cleaning of the baby, and the area where we are keeping the mother and baby. So everything should be clean to prevent the infection. Then high level of disinfection and sterilization we should use for the baby, because they are more prone to have infection and they have less immunity. Then next is wear gloves whenever we are dealing the baby. Protect yourself from splashes or spills of blood, amniotic fluid. Wear eye protection, shoes, face mask and apron. Then second is prepare the birth room. Make sure that the room is clean and warm. So before delivery we should switch on the radiant warmer for the prevention of this uh, so we should to keep the warm. So before delivery we can maintain the temperature. Then make sure that the room is clean, warm, well lighted and the private, because the chances of infection and is more. Then next is keep records. So newborn record card, that is like ID card of the baby, because there are so many other issues are also there, that exchanging the baby and say exchanging of the baby. In that case uh, we should be ready with the newborn cards. The next is immunization card, which is must, everywhere is needed nowadays, immunization card. And for the immunity of the baby it is very much essential to keep the immunization card. And we should teach the parents, and the family counseling is also very much important, because that immunization, what are the benefits of immunization. Because most of the, like those who are from the rural areas or the urban areas, some like those who are under poverty, they don't know the importance of the immunization. Then next is mother's record of antenatal labor and delivery. So that also we should keep, because in long run, or if the anything disease or have congenital disease may be diagnosed, so we can identify the root cause by examining the antenatal record, labor record and delivery record of the mother. The next is collect the equipments and supplies. So medicines for the birth room and the immediate postnatal care, which is mm, much important in a case of emergency, they may be needed. The next is immediate newborn care. So what we can give it to the at the time of immediate newborn care. Immediate newborn care is based on the knowledge of midwife of his transitional requirement and the capabilities. So as we have already discussed, that baby is in the transition phase from the mother's womb to the outer world, so that needs so much care and attention at the time of delivery or till 28 days. Then chance of heat loss by convection, conduction, radiation and evaporation. So optimal thermal environment in delivery room, example switch off the fan. Convection, uh, by fan there is the transfer of heat from a body to the baby may get hypothermia, so we can switch off the fan. Closing the curtain by preventing the radiation. Type of heat loss. Then mechanism of heat loss is, there are four ways for a newborn to lose heat. First is convection. So from air current to in the room. So if the room temperature is cool, then it may be give the baby a hypothermia. Then the radiation is from cold windows, walls. So by touch we can prevent the hypothermia. Then next is evaporation. So now we are not giving immediately bath to the baby, because by evaporation we are preventing the hypothermia. The next is conduction from cold hands or stethoscope. So we should pre-warm everything before touching the baby. Then next is initial care is, as the baby's head is born, wipe or suction out the excess mucus from the nose and mouth. So that the immediate care we should give. Note the time of the birth and sex of the baby, which is must and very much important for the scientific purpose also, and the spiritual purpose also. The people are thinking like birth time is very much important. Then next is cleaning the airway. Hold the baby's hand lower than the body and turn the side for drainage so that whatever the secretions they may come out. Wipe off baby's face and fluids from the nose and mouth. So first is N and then the M in babies. So first is nose, then the mouth. Then suction the nasal and oral passage with soft rubber bulb syringe and mucus sucker, so we can take out the excess mucus. If necessary, mechanical suction we can use for the baby. Then next is decide if baby needs resuscitation. A baby who is not breathing is less than 30 breaths per minute or is grasping needs resuscitation. Quickly clamp and tie and cut the cord, leaving stump at least 10 centimeter long. Put baby on flat warm surface and start resuscitation. So that we will decide immediately after the Apgar score the baby needs resuscitation or not. Second is clamping and cutting the cord. Tie the cord securely on two places. Tie the first one 2 finger away from the baby's abdomen and second one is 4 fingers away from the baby's abdomen. Use a small gauze piece to cover the part of the cord to prevent splashing of the blood while cutting the cord. Then next is cut the cord between the ties. Do not put anything on the cord stump. It will remain like that and left like this, and don't touch the stump without washing the hands, or no need to touch because the chances of me getting the infection is more. Next is dry and stimulate the baby. Rub up and down the baby's back using clean warm cloth. Then next is assess the baby's breathing and color. So face and chest pink, not gray or blue. Pink indicating good sign of adequate breathing and circulation, and blue is blue color of tongue, lips and trunk, sign of lack of oxygen in the blood. Bluish color only on hands and feet present for 1 or 2 days after the birth is normal. Then next is preventing infection. Aseptic technique is must for the prevention of infection. Then next is maintaining the body temperature. Keep the baby's body warm. Wipe off the baby. Bodily contact with the mother. Radiant warmer. 200-watt bulb with the we can use in the radiant warmer. Warm blanket we can use for maintaining the temperature. Then next is prevention of heat loss. So how we can prevent the heat loss? Remove the wet towels and cover with the warm blankets. Skin to skin contact with mother. Keep the baby mother's chest as soon the baby is born. Breastfeeding in the first hour of labor we can prevent the heat loss. Preventing the injury, handling gently, no sudden jerk or we cannot do because it may cause a injury to the baby. Assessing the baby's condition, so by monitoring the Apgar we can assess the condition of the baby. So the score of Apgar will decide the condition. Then next is monitoring the weight is very much important, so we can identify the baby's normal weight, low birth weight, so we can decide the care direction for the baby. Then the clothing, so cotton clothing. Then after the appropriate clothing, giving we use the cotton cloths to the baby. Then next is eye care. We should give the appropriate eye care with the cotton swabs. They are boiled and cool. After that only we can give the eye care to the baby. Then identification is name band. As we are using, there are so many type of bands were available, so which is must immediately after delivery we should keep ready the band, and we can put on the baby band, so we can prevent so many things like exchanging of the babies and all. Skin to skin contact with the mother remaining until gets discharged. Then have the mother to start breastfeeding. The next is close observation at least for 4 to 8 hours, so we can identify if any other thing is or complication is there with the baby or not. Any excess mucus from the mouth we can also we can observe. Any bleeding from umbilical cord, that also we have to check. Hourly temperature until it is stabilized and remain above 30 degrees Celsius. Then administration of injection vitamin K 1 mg is needed. 0.5 ml and 1 mg. 1 mg is the dose for the administration of injection vitamin K. Then third is newborn care during the first day. So what care we can give at the first day? Assess the baby, so that we have already discussed. head to toe examination we should do. Breathing, like if there are any abnormal breathing, warmth, maintaining the temperature is also important. Color we should monitor. Bleeding from any side we should monitor. Give normal newborn care, what we have discussed earlier. Keep warm the baby by giving kangaroo mother care, by giving breastfeeding, by warm clothes, by heater, radiant warmer. There are so many things by using which we can maintain the temperature. Then support breastfeeding and give counseling, telling the parents that what is the importance of breastfeeding. Eye care, cord care, skin care is must, because these are the site where they can get the infection. Other care for any problems or needs. Newborn physical examination we should do. Common newborn problems we should identify and we should tell to the parents. High risk, danger signs, common newborn problems to the parents. Then next is immunization is must to prevent. Nowadays there are so many communicable diseases, so immunization is the only thing by which we can prevent the baby infections. BCG and polio is at the time of birth. Then next is newborn history and physical examination is take history. Objectives of physical examination to detect why we are doing it, so to detect congenital anomalies, to detect illness and birth injuries. Then next is to record body measurement and vital signs. Then next is identify needs or problems of the baby. Then daily assessment and care of the baby during 24 days. So first one is observing the baby. Then next is general care. So what general care we can give? After 48 hours we can give the bath to the baby. Eye care and proper thorough body examination is must. Then next is warmth providing. Then the appropriate sleep, the baby they are sleeping 16 to 18 hours, so like, maximum 22 hours till they can sleep during the first 28 days. Then next is vital sign check. So 4 hourly vital examination if the baby is stable. Then loving care we can teach to the baby because they understand the language of love. Then weight monitoring is must. So weight is a indicator they can tell the baby ka status. The baby is taking appropriate nutrition and everything. Then next is protection from the infection that we have already discussed. While handling, always wash the hands, avoid contact with infectious people, those who are having the communicable diseases. Use everything whichever you are using for the baby should be clean. Skin care we can give to the baby. Then next is the head appropriate assessment, giving the care or that everything is needed. The mouth, how we should give the oral care to the baby. So we should not do the rough dealing with the baby, only with the help of fingers mouth cleaning should be done. Eye care with the boiled cotton swabs we should wipe the after the getting the normal temperature we should clean the eyes with the cotton swabs. Care of umbilical cord we should not apply anything, you should leave the like this, so no like touching or keep dry, so it will automatically shed off after the 5 to 7 days. Then next is genital care. So genital care we should clean it with the cotton swabs, boiled cool cotton swab like after getting the normal temperature. Then next is bathing the baby after the 42 hours, or we should bath the baby. Then next is early and exclusive breastfeeding is must, that most important is breastfeeding. Then elimination we should monitor the baby is passing the meconium urine, because which is important. Then stool color is green for the first 2 to 3 days. Then next is immunization of the baby, that safety and security, we should never leave the baby at the bed edge or baby fall, so safety and security is also important. Newborn danger sign we should explain to the baby, like any chest withdrawal or baby is taking too frequent respirations, so abnormality or everything, any bleeding or high temperature, low temperature, we should teach the newborn danger sign to the family. Then plan for follow-up visits. So if the baby is having any problems, they should come to the hospital for follow-up visits. Then next is teach and counsel mother and family about the newborn care. So appropriate counseling is very much important because the parents don't know how to do the for the baby. So they are the first time parents, or those who are the first time parents, they need so much of counseling, and they are anxious about whether they will be able to manage or not. So we should teach counseling is very much important for breastfeeding and newborn care, and so they need a supportive hand for this. So this is all about the newborn essential care. So hope you like this video. So please do like, share and subscribe, and thanks for watching. So, and please give your comments and suggestions for this, so I can get the direction whether I am doing rightly or not, or which topic is important for the audience. So thanks for watching.